25 new cases of monkeypox were diagnosed in Massachusetts in the last week. That means the state has now seen more than 200 cases since the first case was diagnosed in the U.S. That was back in May.
Yeah, here to provide more insight and answer questions is Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at MGH. Dr. Raja, good to see you. Thanks for your time.
You too, Ben.
All right, so the first patient was actually treated at MGH. As cases are climbing, what important things have you and your colleagues learned about this virus and the risk? What didn't we know when we diagnosed that first case back in May?
That was a pretty scary time, Ben. I've got to tell you, the main thing that I continue to talk to my patients about every day is that monkeypox and COVID, the coronavirus that causes COVID, are really different. We've known this for a while. Both viruses are very different in terms of the fact that we've studied them for decades. But I think when monkeypox cropped up, everybody was really scared that we'd have another deadly pandemic on our hands. But the biggest thing that I remind my patients about every day is that with monkeypox, we actually already have an effective vaccine or two and effective treatment. And with a good, strong, coordinated public health campaign, we can keep monkeypox from spreading the way that coronavirus or COVID did.
Oh, Dr. Raja, thanks so much for that. Lots of people want your attention. We get it. So we've talked a lot about how monkeypox is spread. It's not considered a sexually transmitted disease. We know it is sexually transmissible. It's most common right now in men who have sex with other men. And this weekend, we know it marks Carnival in Provincetown, a huge weekend of the summer. What do people need to know about staying safe?
Erica, you hit the nail on the head, and I'm glad you mentioned it. This is not a sexually transmitted disease, and we need to keep mentioning that because the last thing we don't want to do is stigmatize a population that has already faced stigma for so long. It is, however, as you mentioned, spread by close contact, especially skin to skin. That doesn't have to be sexual. It can be anything, from massages to anything else. And so what we can do to prevent it for everybody is really just take care of ourselves and each other. So if you don't feel well, don't go out. Check yourself for rashes. Check those you care about for rashes. And if you notice anything, definitely seek medical help.
All right, so let's revisit one of the most common questions we get here about this virus. People who got the smallpox vaccine as children do not have additional protection from monkeypox. Why is that?
Yeah, Ben, this is a really good question. It's a little bit complicated. So we stopped vaccinating for smallpox back in 1972. That's when smallpox was eradicated here in the U.S. That means that if you were born before that, you probably had the smallpox vaccine, which sounds great because we're using the smallpox vaccine now for monkeypox. The problem is that immunity wanes over time. It goes down. And so even though it was probably 85, 90% back when you first got vaccinated, that goes down after about 3 to 5 years. And so if you were just vaccinated for some reason, you probably are protected. But if you were vaccinated before 1972 when you were a kid, that immunity is long gone. And if you're at risk for getting it, you really do need to be vaccinated again.
All right, good advice, Dr. Ali Raja with Mass General. Dr. Raja, have a good weekend. Thanks for your time.
Thank you. You too, Ben.
Thank you, Doc.